So she's normal, right? So I have the tissue approximation of the calf, all right, and the hamstring. All right, if I have somebody who had a total knee replacement, okay, I might be feeling a capsular, right, a kind of firm end feel here. All right, and her tibiofemoral capsule would be tight. All right, I come down into extension, okay, and I can do extender and do a little overpressure, right, and feel that firm capsular end feel. See it? She's got a little motion there with her overpressure. Now, if her joint's swollen and sore, am I doing overpressures? No, right? I don't need to. Right? I know, she's swollen, she's sore, and I don't need. If she has kind of normal, and active range of motion really hasn't elicited much, then I want to see if compressing the meniscus and those structures maybe can bring about some discomfort. So I know what I'm going after when I do my special test. All right. We said we can do some tibial. So we said actively they can't do tibial motion independently. But look, so what I'm doing is a lot of times we don't, we could move the foot, okay? But I like to kind of take it at the distal tibia and the fibula, okay? Because that way there's not as much torque on her foot. And look, there's some external rotation there, all right? And then we can do the same thing. I'm taking over here. And there's less internal rotation and more external rotation. Does that make sense? Yeah. Okay. Good. So if she had a total knee replacement done, I might, look at this and she might be really limited in her external rotation. All right. And then with accessory motion, all right. So with accessory motion, all we're doing is just kind of looking at the glide. So I can put her in a resting position. All right. If I don't want to, Jim, grab that foam roll back there, please. If I don't want to hold her, right, I got all these neat things in the clinic, right? So if you take something like this, all right, that puts her in about 20 to 30 degrees of flexion, all right? So now I got one hand to stabilize, and I have one hand to kind of test, so I can do an anterior glide, all right? This might get in the way of a posterior glide, so I'll just kind of do it. I can do a posterior glide. Okay. I can do a lateral glide. I can do a medial glide. All right? And I can just see how that feels compared to her uninvolved side and see if it feels, really tight. Now your reliability between yourself is pretty good, all right? But the reliability, so your intra, all right, reliability is pretty good. But the reliability between different people on these sorts of things isn't real good. So if I come up and do it, I might say, oh, she's a little bit limited, and then Bray might come up and do it and say, oh, she's really, really limited, all right? So it's pretty good between yourself, all right? But we can look at that. And then again, just like we did passively, we can look at that, the rotations. And then for the patella, we just want her to relax, right? Her quads, okay? And full extension. And then what we can do is we can just do a little bit of, with our thumb and index finger, we can go medially and laterally and assess patellar movement medial and lateral, and then we can kind of go superiorly and inferiorly, all right, with our thumb and index finger and assess movement there.